Okay, go back to the highest level of assessment of the research, not only research, but the evaluation of research, the meta-analysis. I was able to find 76 different meta-analyses, 30, a little less than half, were on diarrhea, 11 on IBS, also on Helicobacter, the premature babies, intensive care, urogenital infection. It doesn't mean that all of them gave a positive evaluation. Most of them are negative, I have to say. Better, most of them are asking for more research. They say that we have no enough data to conclude for a positive or a negative evaluation. But here we have the problem, because the meta-analyses on diarrhea are mainly providing a positive outcome. Most of the meta-analyses say there is a good evidence the probiotic have a good action against diarrhea, reduction of the risk, reduction in the duration, and so on. But the studies that have been reviewed by meta-analysis have been done with unhealthy people. It means that this is the use that FAO-WHO in 2001 has classified as the biotherapeutic use of beneficial organisms. This is a very long debate. I remember that at the beginning there was really a lot of skepticism about this. But you know, when you work in a panel of FAO, you have the word to consider. And in several parts of the world, beneficial organisms are drug. They have to send a drug master file. They have been registered. So at the beginning, the scientific officer of FAO, Maya Pinheiro, told us that we have to divide the therapeutic use and the food use. That was the original sin, let's say, or the original stone. And it's difficult to do this. Sometimes it's very difficult to draw the line. But according to also what EFSA is doing in these days, we have to do this. Because otherwise, this is the answer of EFSA. The claimed effect is digestive health. It is assumed that the claimed effect relates to acute diarrhea associated with antibiotic treatment. The target group is subject receiving antibiotic treatment. The claim does not comply with the criteria laid down in regulation. So we have put a lot of money in this study. We have enrolled a lot of subjects for nothing. That's the situation. Another, here we have the meta-analysis. It's the other side of the moon. The meta-analysis say, okay, they works, show an overall reduction in the risk of antibiotic-associated diarrhea when probiotics were co-administered with antibiotics. But these kind of studies are not accepted by EFSA. This is what we can conclude for the literature search. There is a big gap in the bridge of Gare. Again, administration, these are a couple of conclusions of meta-analysis on immune system. Administration of probiotics associated with lower incidence of ventilator-associated pneumonia. Data from meta-analysis suggest a modest role for probiotics, but a role in pediatric atopic dermatitis. The effect is seen in moderately severe rather than in mild disease. Positive meta-analysis. But EFSA cannot accept. It is not a problem of EFSA. It is a problem in the regulation, in the beginning. So, just to conclude, to open the debate, we have a huge literature spread all over the world, a growing literature. New groups and new research groups are entering into the field. But we are dealing with different products. I don't want to add anything to what Gers has already presented. Probiotic means strain specificity. We have different protocols. If you go to the through the opinions of EFSA, it is pretty clear that they cannot consider a clinical trial done with a single product, but with a different daily dosage. 1 pot per day, 2 pots per day, different dosage, they cannot accept. We have solid outcomes from the probiotic research, but unfortunately, a very few of them are applicable for the current EU regulation. So what we have to do, we have to change our protocols, or we have to really put some pressure on EFSA in order to have a different mandate from Sanco, because I have worked for EFSA for a different panel, and I know that the power of EFSA in changing the mandate is very limited. So the problem probably is more here in Brussels, in DG Sanco, than in Parma for EFSA. And thanks for your attention.